Do you suffer from low back pain? If so, you're in the right place, because today we are discussing two therapeutic options for you: acupuncture versus physical therapy. Now, I do not believe that you need to learn to live with pain, which is why I started this channel, because I want to be able to give you the information you need so that you can relieve your pain without the use of pharmaceuticals. Now, if that is you, if you are the person who is currently popping pills because you have chronic pain and you're just trying to make it through your day, then I want to give you a gift. My 30-day pain-free jumpstart guide. It's totally free. It's an easy step-by-step guide, just there to give you a foundation and ways in which to ease your own pain at home in 30 days or less, so that one day you don't need to rely on pharmaceuticals to make it through your day. I've left the link down below. Now let's get into the content. Welcome to Dialectic Healing, where we discuss a fusion of physical and mental therapies so that you can obtain and maintain your healthiest self. All right, let's give a quick overview of your anatomy. Yes, you have 5 lumbar vertebrae, and you have the spinal erectors and the QL muscle that incorporate that low back area. But the low back isn't just a lone ranger. It's got a team of other muscles, including your pelvis, your sacrum, the SI joint, and the glute muscles. You've got your iliopsoas on the anterior aspect that are your hip flexors that attach directly to the anterior part of your pelvis and the anterior part of your lumbar vertebrae, all working as a lever and pulley system to make sure that you have nice fluid movement and that there is nice weight distribution between your upper body and your lower body. But if you have low back pain, you know where it is. But the question you ought to be asking yourself is, where is it coming from? Do you have muscle weakness? Do you have a biomechanical misalignment? Do you have tight hip flexors? Is your psoas pulling your low back? Do you have an anterior rotation in your pelvis because of tight quads, tight hip flexors? Do you have tight hip rotators and your piriformis is now pinching off the nerve, causing pain all the way down your leg? Are you just sitting all day at your job and your core is weak, but your hips are tight and you're taking your mental stress and storing it down in your low back? I realize that our typical idea of storing stress is in our neck and shoulders, our jaw, but your low back can easily hold on to that stress just as much as any of those other areas. All of these questions really hone in on where your problem and where the cause is coming from. The pain is just the symptom. So I mentioned stress as one of the areas that your pain could be coming from. And this is really important because understanding your nervous system is one of the key ways to understanding pain. So your nervous system runs in a very black and white way. And while the rest of us are running in a gray space where we're relaxed, but we're also stressed out about money or work, but we're hanging out and playing with our kids, or we're walking our dog. We live in this gray area. However, your nervous system does not. Unfortunately, you have a very polar opposite state. You either have your parasympathetic, which is your rest and digest state, or you have your sympathetic, which is your fight or flight state. And stress puts you in that sympathetic state. And when that happens, your whole body gets turned on into fight or flight. Every muscle goes into heightened state. Your liver starts kicking out glucose so that in case you haven't eaten in a while, You can have the energy to fight or run, and your digestive system stops working because the last thing you want to do is actually have to go to the bathroom while you're stressed out. And number one, your muscles just tighten up. Your face starts wrinkling and your shoulders start clenching. You might even be holding tension right now while you're watching this. And if that is you, take a nice deep breath and soften your body. If you felt a change, then stress might be the reason for your pain. And if that is the case, then acupuncture is what I'm going to suggest for you. The National Institute of Health has been studying acupuncture for decades at this point, at least a decade. And what they've discovered is that when a needle is inserted in particular acupuncture points, its effect on the nervous system is miraculous because it takes you out of that sympathetic fight or flight state and it puts you back in the ideal rest and digest parasympathetic state, so that your muscles can be softened and calmed. Your liver isn't kicking out a bunch of glucose any longer. Your heart can calm down. Your blood pressure can calm down. Every part of your body, not just your low back pain, but every part of your body starts to function better. Now, if that is you, I highly recommend that you see an acupuncturist. Now, the alternative is physical therapy, and I still do recommend plenty of my patients to go see a physical therapist. Number one, because I recognize that their pain is actually coming from a muscle weakness, either within their core, whether it be your abdominal muscles. Mainly, it's usually obliques, to be quite honest. Or if you have over tight muscles in the glutes and you have improper muscle activation, a physical therapist is who you want to see because they are going to give you exercises, stretches, they're going to work on your posture, they're going to work on strengthening the muscles that need to be strengthened and loosening up the muscles that need to be loosened so that you're gaining your mobility, you're gaining that flexibility and proper muscle activation, proper posture, while gaining the strength so that you have an overall proper functionality of that entire team that makes up your lumbar area, your low back area, your glutes, your pelvis. Everything needs to work together. And physical therapy is really good at addressing all of that. I want to give you a word of encouragement because if low back pain is something that you've just acutely started feeling, or if it's something that you've been chronically dealing with for a very long time, and you don't want to have to keep popping pills in order to make it through your day, then please download my 30-day Jumpstart Guide. It's going to give you exactly what you need as a foundation for helping yourself throughout your day, at home, at your workplace. But know that there are therapists out there, that their entire career is built around helping relieve your pain, whether it be physical, mental, or a combination of both. I hope that this content was helpful for you. And please leave me a comment down below if you've tried acupuncture or physical therapy for your low back pain and you've either met with success or you're still struggling. I'd love to have a conversation about it. This is why I started my channel, just so I could reach more people to try and help them relieve their pain. In the meantime, may your pain be relieved.